Sesamoid bones are small, round bones embedded within tendons, usually found in locations where a tendon passes over a joint. These bones act to protect the tendon and improve its mechanical efficiency, often by altering the direction of muscle pull and decreasing friction. The most well-known sesamoid bone is the patella kneecap, which is the largest sesamoid bone in the body. Other common locations include the hands, particularly in the thumb, the feet under the big toe joint, and sometimes in the knees or wrists. Their role is primarily to enhance movement efficiency and reduce wear and tear in areas that experience a lot of tension or pressure. Issues with sesamoid bones can lead to conditions like sesamoiditis, which is an inflammation of the bones and surrounding tendons, often seen in athletes or dancers. Benefits of sesamoid bones. 1. Protection of tendons. Sesamoid bones shield tendons from excessive wear and tear as they pass over joints, especially in high stress areas. 2. Enhanced movement efficiency. By altering the angle at which a tendon acts on a joint, sesamoid bones improve mechanical efficiency, making movements smoother and requiring less effort. Force distribution. They help distribute the body's weight and force across the joints, especially in weight-bearing areas like the foot, which reduces stress on the tendons and ligaments. Functions of sesamoid bones. 1. Improved leverage. Sesamoid bones act as pulleys, increasing the efficiency of muscle contractions and allowing for greater force generation in movements, especially in areas like the thumb, hand, and big toe, foot. 2. Reduction of friction. By guiding the tendons, sesamoid bones reduce friction between the tendon and the surrounding bones and joints, preserving tendon health. 3. Support in weight-bearing joints. They stabilize and support weight-bearing joints, especially in the foot, ensuring smooth, coordinated movements. Problems associated with sesamoid bones. 1. Sesamoiditis. Inflammation of the sesamoid bones and surrounding tendons, commonly seen in athletes, dancers, or people who engage in repetitive, high-impact activities. Symptoms include pain, swelling, and difficulty with movement. 2. Fracture. Sesamoid bones are prone to fractures, especially from trauma or excessive pressure, e.g., running, jumping. This can lead to pain, swelling, and difficulty in movement. 3. Osteoarthritis. The sesamoid bones can develop osteoarthritis, particularly if they have been subject to repeated trauma or stress, leading to chronic pain and stiffness. 4. Avascular necrosis. This condition occurs when the blood supply to the sesamoid bone is compromised, leading to the bone's deterioration, pain, and functional impairment. It is most commonly seen in the foot sesamoid bones. Sesamoid bones exhibit several variations in terms of size, number, and location, which can differ from person to person. These variabilities are significant in clinical practice, particularly in imaging and diagnosis. Some key variabilities include Number 1. Number of sesamoid bones. Normal variation. Most individuals have a standard set of sesamoid bones in typical locations like the foot, hand, and knee, patella. Supernumerary extra sesamoid bones. Some people may have additional sesamoid bones, which can be incidental findings on x-rays and are usually asymptomatic unless fractured or irritated. Absent sesamoid bones. In rare cases, one or more sesamoid bones may be absent, which can affect joint function, particularly in weight-bearing areas like the foot. 2. Location of sesamoid bones. Common locations. Foot. The most common location for sesamoid bones is under the metatarsophalangeal (MTP) joint of the big toe. There are usually two sesamoids here, medial, tibial, and lateral, fibular. Hand. Sesamoid bones are often found in the thumb at the metacarpophalangeal (MCP) joint. Knee. The patella is the largest sesamoid bone. Wrist. Small sesamoid bones can also appear in the wrist near the tendons of the thumb. Uncommon locations. Rarely, sesamoid bones may develop in unexpected locations like the elbow, shoulder, or spine, typically seen as anatomical variants. 3. Size of sesamoid bones. The size of sesamoid bones can vary significantly. For instance, the patella is the largest sesamoid bone, while others, such as those found in the hands or feet, are small and may be barely visible on standard radiographs. 4. Shape and structure variations. Sesamoid bones can vary in shape. While many sesamoid bones are round or oval, some may appear more irregular or fragmented. Some sesamoids may also be bipartite, two separate parts, or multipartite, meaning they are naturally split into two or more segments. This is especially common in the patella, and it can sometimes be confused with a fracture. 5. Developmental variations. Sesamoid bones develop in response to stress, so their size and number may be influenced by factors like activity levels and mechanical forces exerted on the joints. For example, individuals who perform high stress activities, like athletes or dancers, may have larger or more prominent sesamoid bones. In some individuals, sesamoid bones may not fully ossify, leading to cartilaginous or partially developed sesamoid bones, which can make imaging and diagnosis challenging. Clinical importance of variability. Misdiagnosis. Variations, such as bipartite sesamoid bones, can be mistaken for fractures, especially if there is pain or swelling in the area. Anatomical adaptations. Extra or missing sesamoid bones may alter the biomechanics of movement, especially in the hands and feet, potentially leading to conditions like hallux valgus or sesamoiditis. There is a general consensus that the patella is a sesamoid bone, and this classification is widely accepted in anatomical and medical literature. The patella meets the key criteria for a sesamoid bone. It develops within a tendon, the quadriceps tendon, and it functions to protect the tendon and enhance the mechanical efficiency of the associated joint, the knee. Why the patella is considered a sesamoid bone? 1. Location and development. The patella forms within the quadriceps tendon, making it the largest sesamoid bone in the body. Like other sesamoid bones, it is embedded in a tendon at a joint where high mechanical stress occurs. 2. Function. The patella improves the leverage of the quadriceps muscle by increasing the distance between the tendon and the knee joint's axis of rotation, much like how other sesamoid bones increase mechanical efficiency in the hands and feet. Is there any debate? While the classification of the patella as a sesamoid bone is largely agreed upon, the patella is sometimes distinguished from smaller sesamoid bones in terms of its size, importance, and role in joint function. However, this distinction does not create debate over whether the patella should be considered a sesamoid bone. It remains classified as such due to its characteristics and developmental origin. In summary, while the patella stands out from other sesamoid bones due to its size and prominence, it is universally considered a sesamoid bone without significant controversy. Sesamoiditis is an inflammatory condition affecting the sesamoid bones in the tendon and surrounding them, most commonly in the foot. It typically involves the sesamoid bones under the big toe, hallux, specifically at the first metatarsophalangeal (MTP) joint, though sesamoiditis can also occur in other parts of the body where sesamoid bones are located. Causes of sesamoiditis. Sesamoiditis results from repetitive stress, overuse, or trauma, leading to inflammation in the bones or surrounding tendons. Common causes include 1. Overuse or repetitive strain. Activities that place excessive stress on the ball of the foot, such as running, dancing, or high impact sports, can lead to irritation of the sesamoid bones. 2. High impact sports. Sports that involve frequent jumping, running, or sudden directional changes, e.g., basketball, tennis, or ballet, increase the risk of sesamoiditis. 3. Foot structure. Individuals with high arches, flat feet, or abnormal foot biomechanics may be at higher risk, as these foot shapes can cause uneven pressure distribution across the ball of the foot. 4. Improper footwear. Wearing shoes that lack support, especially high heels or shoes with thin soles, can put extra pressure on the sesamoids. 5. Trauma. Direct impact or injury to the sesamoid bones, such as a fall or sudden twist, can also trigger inflammation. Symptoms of sesamoiditis. The symptoms of sesamoiditis can vary depending on the severity of the inflammation, but typically include pain. Pain at the base of the big toe, especially under the ball of the foot. The pain may worsen with walking, running, or pushing off the toe. Swelling. There may be noticeable swelling around the affected area. Tenderness. The area over the sesamoid bones is often tender to the touch. Limited mobility. Bending the big toe or walking may become difficult or painful. Pain with weight bearing. The pain typically intensifies during weight bearing activities, such as running or standing on tiptoe. Diagnosis. Diagnosis of sesamoiditis involves a combination of clinical examination and imaging studies. One physical exam. A doctor will palpate the area around the ball of the foot to check for tenderness, swelling, and pain with movement. 2. X-rays. X-rays can help rule out fractures of the sesamoid bones or other bone-related issues. 3. MRI or bone scan. These may be used if X-rays are inconclusive, as they can reveal inflammation or subtle fractures that may not be visible on X-rays. 4. Ultrasound can help visualize soft tissue inflammation around the sesamoid bones. Treatment for sesamoiditis. Most cases of sesamoiditis are treated conservatively with a focus on reducing inflammation, relieving pain, and preventing further stress on the sesamoid bones. 1. Rest. Reducing activity, especially high-impact sports or prolonged standing, allows the inflamed sesamoid bones to heal. 2. Ice. Applying ice to the affected area for 10 to 15 minutes several times a day can reduce swelling and pain. 3. Footwear modifications. Wearing cushioned shoes with good arch support or avoiding high heels helps reduce pressure on the sesamoid bones. In some cases, custom orthotics or inserts designed to offload pressure can be beneficial. 4. Padding. Adding soft padding, such as a sesamoid pad or dancer's pad, under the foot can protect the sesamoid bones from further strain. 5. Anti-inflammatory medications. Non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, can help reduce pain and inflammation. 6. Physical therapy. Stretching and strengthening exercises can help improve foot mechanics and reduce the risk of recurring sesamoiditis. 7. Corticosteroid injections. In more severe cases, corticosteroid injections may be recommended to reduce inflammation. Severe or chronic cases. In cases where conservative treatment fails, additional interventions may be needed. Immobilization. In more severe cases, wearing a walking boot or cast to limit movement and offload pressure on the sesamoid bones may be necessary for a period of weeks. Surgery. Rarely, if sesamoiditis becomes chronic and unresponsive to conservative treatments, surgical removal of one or both sesamoid bones, sesamoidectomy, may be considered. However, this is generally a last resort as it can alter foot biomechanics. Prevention of sesamoiditis. Proper footwear. Wear shoes with proper arch support, cushioning, and a wide toe box to reduce pressure on the sesamoid bones. Gradual activity increase. Avoid sudden increases in activity levels, especially in high-impact sports. Stretching and strengthening. Regular stretching and strengthening exercises for the feet can improve foot mechanics and reduce stress on the sesamoid bones. Foot care. Pay attention to any early signs of pain or discomfort in the ball of the foot, especially if you're active, and address these issues early to prevent chronic problems. Prognosis. With appropriate treatment, most cases of sesamoiditis improve within a few